Hey, it's a Wednesday morning. Let's bring him in. He's been part of this show for over 30 years. My good friend, Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Dr. Joe, good morning, my friend. What do you have for us today?
Good morning, Ray. Hey, I want to give a little love, a little track love to our track athletes who are preparing now as they move down toward the districts and regionals and states. And they've been working hard for a long time and talk about some issues that they run into. A lot of them, they run in the fall a lot with cross country, some of our distance people. They run indoor now that we have some indoor facilities. So they run year round. And as they get ready for these big meets at the end of the year, the last thing in the world they want is to get injured. And the big injury that we see a lot in runners and track athletes that they want to stay away from for sure this time of year are stress fractures. So I wanted to talk a little about stress fractures. Typically, the most common part of the body is the lower extremity, the legs and stuff. So the tibia bone, the shin bone, is the number one bone for stress fractures. About 50% are in the shin bone. The second is the foot, the metatarsals. Those are the long bones of the foot. Of the 5 long bones of the foot, guess which one is the second, is the number one most common one to get a stress fracture is the second metatarsal. It's not the great toe. By the way we run, we put most of the pressure on the second toe, and it is the longest and thinnest. So we see a lot of stress fractures in the second metatarsal. In the skinny bone in the lower leg, the fibula bone's number 3, that's about 10%, and the femur bone is a little less than 10%. That's the big, strong bone. If they get a femur stress fracture, that's a concern to us right away. So I wanted to tell you a little about how we kind of go about working this up. The causes for stress fractures typically, of course, as you would know, would be overload. I mean, these kids are doing a lot. They're running a lot. They're active a lot. And so overload. And back in the early days of my career, hey, it was enough to just say, hey, most of these are overload injuries. But we did start to find out as time went on, there definitely can be other factors we find out if they continue to struggle with this. Number one on the list besides overload is hormonal factors. And so particularly in some of our female athletes with abnormal menstrual cycles, they get hormonal issues that decrease their bone strength, their bone density, and they're at risk then for recurrent stress fractures. So we keep an eye out for that. Also, the way people run, the mechanics of how they run. So our coaches are really good, but so are our trainers and stuff. If we see mechanical issues, we may want to make changes. But then there's some other things that are a little bit less rare. We see vitamin D deficiencies, calcium deficiencies, thyroid hormone problems, iron deficiency, anemia, even inflammatory bowel disease like Crohn's sometimes is picked up by people who are getting stress fractures. So we want to decide who gets a workup. Not everybody with an uncomplicated stress fracture needs to go right in to get a workup. And so the people that need to get a workup are those athletes, Ray, who have had multiple stress fractures, more than one, atypical location. It's not in a place we normally see them. Delayed healing. If they take more than 4 to 6 weeks to heal with appropriate treatment, we're going to probably do a workup on them. And we talked about menstrual irregularities. That generally is going to require getting a DEXA scan. That's a cool medical term for a bone density test. And so bone density tests are fairly common in a sport medicine clinic to find out, are the bones strong in these people? 15 to 20% of our high school female athletes have decreased bone density, 15 to 20%. But my performance specialist, who we hired about 5 or 6 years ago, she does a lot of our more complicated stress fractures, Dr. Michelle Levitt. Dr. Levitt was telling me yesterday, please don't forget the male athletes. A lot of people just don't think males get stress fractures, and they do. About 3 to 5% of males will have weakness in the bones, too, bone density issues, and they need a DEXA scan as well. A lot of times there will be a family history for this, too. So we want to ask the family history question about the weakness of the bone. So kind of in summarizing things, one of the big issues is what's called underfueling. For a lot of these athletes, they don't fuel enough. They don't take in enough nutrition. So we also have a sports nutritionist on our team to review their diet and see if they're getting enough calories and enough protein to protect those bones so that we don't get stress fractures. And in some cases, if our back's against the wall, we may see deficiencies in areas where supplements would help. There's general supplements that we used to use like vitamin D and calcium and magnesium and zinc and others. But there's also some more complicated ones that I wouldn't get into this morning. But supplements can help too. And I'll say it again, remember the male athletes. If they're having localized pain with running for a period of time, check them for the stress fractures too. Check them for the bone density, because we definitely find that male athletes are in this category as well. So finally, the complication, if people ignore it or just have nothing to do with it, they run through it. We know that every year we find some people that get a complete fracture where that tiny micro breaks through all the way into a complete fracture or a compound fracture. And in a great place like Akron, Ohio, let's not have any of those complete or compound fractures. Get in early. Get in to see your doctor. Your sports medicine docs and your trainers are really good at picking up stress fractures. And that's one thing we don't want to see in the next 2 or 3 weeks is these hardworking athletes prepare for going down to state.
Well said, Joe, and good information. It's always a worry. As you know, I got 2 athletes that do the cross country and track, so that's always in the back of my mind when you talk about stress fractures. Great info this morning, my friend. Thank you.
Yeah, keep those antennae up with your kids, and if they start heading in a direction that you're just not sure of, there's lots of answers out there, starting with your athletic trainers and then moving on into the sports medicine team. So thanks, Ray. Good talking to you this morning. Have a great Memorial weekend, okay?
You too, my friend, and we'll talk to you next week.